And right. Go ahead and get started right now at 5:30. So if you could all mute yourselves at this time. Thank you so much for your participation here tonight and your cooperation in making the best possible press conference audio we can. We really appreciate your joining us. Tonight's presentation is the COVID-19 vaccines, what you need to know. We have a 1-hour time frame. Our Zoom event here is capped at 100 participants, so you're all lucky you're on, but we're also live streaming on Facebook just in case there are additional people who can't join past our 100 mark. If you have a question, we would really love for you to participate by entering that question in the chat box. So take a moment now to find that chat box. I've been chatting out a whole lot. I put everything that's on the screen also in the chat for those who might join late. So that's where you would enter your question. And if there is a specific panelist that you'd like to answer the question, please address your question to that individual. Please keep your audio muted throughout this event. Unfortunately, we just have too many people on the call, so we won't be allowing members of the public to speak. Only our panelists will have that ability tonight. So if you could, please keep yourself on mute, but we have 3 event moderators who will put you on mute if your audio is on. Please don't take that as any sign of being rude or disrespect. We just need the audio to be as clear as possible so everyone can hear. If we do need to mute your audio multiple times, if you're just not playing by the rules, we may need to remove you from this event. Just wanted to give everyone a heads up on that from the get-go. We're going to take as many questions from the chat box tonight as we possibly can in our 1-hour time frame. If we've run out of time, we will certainly answer any remaining questions on our website, which is up here on the screen. It's also in our chat box. This is the Sauk County Public Health website on COVID-19 vaccines. We will also answer questions in our weekly vlog. It's a video blog that we do every week, and that's recorded on Thursdays. So look out for that, please. If there are members of the press present tonight, we welcome you to record this session. So we're going to jump right in then with introducing our panel speakers. I'll start by introducing myself. My name is Sarah Jesse. I'm a community health strategist for Sauk County Public Health, and I'll be your main moderator tonight, helped by my colleagues in public health, Siobhan Allen and Jody Molitor, who are also going to be manning the moderation behind the scenes here. We're going to go ahead and have our panel speakers introduce themselves one at a time in the order that you see here on the screen. And we will start with Kathy Warwick in public health. You might notice that all of our speakers, I believe, are not wearing masks right now, and that's because they're in their own private spaces that are enclosed away from the public. So just wanted to let everybody know that. Kathy, can we have you introduce yourself first, please?
Sure. I'm Kathy Warwick with the Sauk County Health Department, and I'm the Deputy Director here. Welcome.
Thanks. Thank you, Kathy. And Jessie Phelan is next.
Hi, I'm Jessie Phelan. I'm the Nursing Manager for the Health Department and Operations Section Chief for our COVID response.
And Barb.
Sorry, Barb Walsh, public health nurse with the Sauk County Health Department, and one of my main programs are immunizations at the health department.
Excellent. Jeff Jelnick.
Hi, I'm Jeff Jelnick. I'm the incident commander for the Sauk County Public Health's COVID-19 response.
Excellent. And then we'll move on to Reedsburg Area Medical Center, where we have Dr. Baker.
Good evening, I'm Dr. Liz Baker. I'm the Chief Medical Officer at Reedsburg Area Medical Center.
Excellent. And from Sauk Prairie Healthcare, we have Dr. Hupp.
Good evening, my name is Janelle Hupp. I work at Sauk Prairie Healthcare. I'm a family practice doctor and chair of our infection control committee.
And Dr. Shad.
Good evening. My name is Dr. Todd Shad. I'm a OB-GYN at Sauk Prairie Healthcare and Reedsburg Medical Center, and I'm also the Chief Medical Officer for Sauk Prairie Healthcare. Thanks for inviting me.
Thank you. And last but certainly not least, Dr. Murphy from SSM Health and St. Clair Hospital.
Hello, I'm Maureen Murphy, and I'm a family medicine physician at the Wisconsin Dells Clinic and Chief Medical Officer at St. Clair Hospital. Thank you.
Wonderful. Thank you so much to all of our panel speakers. We took the most frequently asked questions about the COVID-19 vaccines and assembled them together, this dream team of public health and healthcare providers to answer these questions. So we're going to jump right in with more of an introduction. Kathy, can you tell us please why we've called this press conference today?
Yeah, I'd love to. I'd ask you all to imagine the day when you can stop wearing a mask. Breathe in, breathe out, no barriers. I was doing that today and I thought, what a wonderful feeling. Or when we can gather indoors at our favorite restaurant again with family and friends for a celebratory meal. And that day is coming. But only if we do what needs to be done today to keep ourselves, our families, our communities, and our country healthy and safe. So we're speaking tonight on behalf of public health and our local healthcare systems. And our goal is, and always has been, to keep the people in our communities safe and healthy. This is especially true now in this challenging time of COVID. And with the COVID-19 vaccines, in addition to our ongoing hand washing, distancing, and mask wearing, that offer us now a new opportunity to protect ourselves and those around us. And that's from our family and friends to the people ringing up our groceries. We know all of you joining us want to stay safe and keep your family safe. And part of that really involves ensuring that you have the information that you need about these vaccines to make an informed decision. We know many people have questions about the vaccines, and that's why we're here. And some people who are opposed to it have made people concerned with misinformation about the vaccines. At the same time, there are many people who want the vaccine or are considering it because it can mean that we can keep our loved ones safe, keep our schools open, get our local businesses back on track, and move our communities forward. As more people are vaccinated, we can protect healthcare and essential workers, those people that are highest at risk in our broader community. And we can return to normal, or what will probably be a new normal. Our focus tonight is on providing you with clear, accurate, and research-based information, but keeping our community's health front and center. And I thank all of you for joining us.
Thank you, Kathy. And Dr. Murphy, we'll turn to you next from the healthcare perspective. Why should I get vaccinated when it's my turn?
Well, thank you, Sarah, and thank you to all of the participants. Our mission as healthcare providers is the health and well-being of our communities. We know our county residents care about the health of our communities too. As you've seen on the news and read about, our doctors, nurses, and healthcare staff are going above and beyond to take care of our communities. Our small businesses and the people who work there are struggling to stay afloat. One way you, each of you and your families one thing you can do to help keep each other healthy, support our healthcare workers, and get Sauk County back on its feet is to get vaccinated against COVID-19. We've spent all, 9, 10 months working to treat COVID the best we can. Now we're going to use this tool to prevent COVID. When we get vaccinated, we can stop that passing of the virus on to one and to another and to another. We can break that cycle and help slow the surge. Like previous pandemics, such as polio, the easiest and fastest way to get rid of COVID is to be vaccinated against it. Experts believe, however, that we will, initially it was 65%, but now with this new, more infectious variant of COVID, they're now saying probably need about 75% of us to get vaccinated to achieve the herd immunity and be able to really stop this virus in its tracks. I want to echo what Kathy said. We are very aware that there are many, many people who have hesitancy about the vaccine, who have a lot of questions, a lot of concerns. So we are so grateful that you are taking the time to learn and appreciate your openness to hearing what we have to share with you. Thank you.
Thank you, Dr. Murphy. Now let's turn to Dr. Liz Baker. How do these vaccines work for COVID-19?
Thank you, Sarah. This is a fun question. Understanding how these vaccines work, this is the tool to understand how we're going to fight this pandemic. And we totally understand that a lot of people are nervous about receiving one of these COVID-19 vaccines, and this is very reasonable. And fortunately, researchers have been working on vaccines for the coronavirus family for many years. So researchers didn't have to start from scratch. I think it's important, though, that we first talk about just how does a vaccine work. A traditional vaccine works by taking a very small and harmless part of a pathogen, like a virus, and that part of that pathogen teaches our body how to fight it before we actually come into contact with that virus in real life. So think of vaccines like taking a self-defense training course, but for your immune system. Your body's going to learn the skills that it needs, so when the real thing shows up, it's got a defense mechanism. So the COVID-19 vaccines use a new technique. Instead of injecting a piece of a pathogen, instead, they're injecting a tiny piece of genetic material called messenger RNA, or mRNA. mRNA is a set of instructions that tells our cells to make a specific protein. Your cells do this automatically all of the time. Your cells are doing this right now. So this vaccine just slips a set of instructions into our cells to make a small piece of protein called a spike protein, which is found on the outside surface of the coronavirus. So this vaccine uses our own cells' mechanisms to make a protein that then triggers an immune response inside of our bodies. That immune response, which produces antibodies against the coronavirus, is what is going to protect you from getting infected when the real virus comes into contact with your body. And the COVID-19 vaccines are the first ever messenger RNA vaccines that have been made available for widespread use. What's so neat about these types of vaccines is that we know that it cannot give someone COVID-19. And just because the vaccine uses messenger RNA, which is genetic material, the vaccine cannot affect or interact with our DNA, our own genetic material in our cells, in any way. In fact, the messenger RNA, it actually never enters the nucleus of the cell, which is where our DNA is kept. Instead, the cell breaks it down and gets rid of that messenger RNA after it's finished using the instructions. The analogy I like to use is when you go to a restaurant, which someday soon we'll be able to do that, and your menu that you get to read off of is laminated. I can't add a dish on, I can't remove a dish from that menu, I can just read it. When the waiter comes by to take my order, the order is written onto a piece of paper, which is then taken to the kitchen to make the meal. That order on that piece of paper is messenger RNA. It just carries the instructions for making something. And just like in a restaurant, once that order is read and the food is made, they get rid of that piece of paper. We don't want to have extra instructions running around. So when you have the vaccine, about after 6 hours, all that's left is your body's immune response and your own antibodies to fight off the coronavirus, which makes this a really awesome way to fight this disease.
Thank you for that explanation. So thorough and yet so clear exactly how this science works. That's awesome. All righty, well, we're going to turn to Dr. Hupp for the next question. The COVID-19 vaccines were developed very quickly in record time. What was the research process used to make sure that these vaccines are safe?
That's a great question, Sarah. And I think that a lot of folks are worried that steps were skipped in the process because things happened quickly. And thankfully, that is not the case. And I think it helps to have a little perspective on how a normal vaccine goes through the process. So typically, a vaccine is created by a pharmaceutical company, and they start by doing preclinical testing in the lab on mice and lab animals just to see if the vaccine shows promise, and to see if it's safe, and to see if it will have a chance of protecting against disease. At that point, then, if it passes that stage, it moves into the phase 1, 2, and 3 trials. The phase 1 trial is done on healthy adults, very robust healthy adults, small numbers of people. And that phase 1 trial is mostly to determine the safety of the vaccine in humans, and also to determine if humans will make antibodies that will protect them. So when the vaccine passes that stage, it moves into phase 2 trials. Those trials are more aimed at target populations. So these are larger numbers of people, and they may include, they may not all be healthy people. They may include elderly people. They may include people with multiple different medical conditions. And this phase 2 trial is, again, looking at the safety of the vaccine. It looks at the immune response. Will people make antibodies after being injected with the vaccine? And also, this phase is helpful in determining whether a vaccine might need booster doses, or maybe be on a particular schedule or given to an individual at a certain age. So if the vaccine moves through phase 2 trial, it then moves on to phase 3 trials. And these are where vaccines are given to lots of people. So tens of thousands of people get the vaccine in phase 3 trials. And again, these are people who are high-risk people, because you're really testing the vaccine at this point. Is it going to work to protect individuals from a particular disease? So all 3 phases look at safety, and all 3 phases are looking at immune response. But this is really where the rubber meets the road in terms of, will it work to protect against disease? So in normal vaccine development, pharmaceutical companies are doing these steps in sequential ways. So they'll progress through each step sequentially. And if it looks like they have a vaccine that they're pretty certain will get approved, it's then at the end of the process that they start to think about manufacturing that vaccine. So with the COVID vaccine, we had something called Operation Warp Speed. And that was a program developed by the federal government where, because this was a global emergency, we needed to find a fast way to move vaccine candidates through the process. So thankfully, there were several vaccine candidates that were presented to the FDA, and a number of them looked promising, and the FDA took, I think, 8 or 10 of those vaccines and used them and decided to put billions and billions of dollars into those pharmaceutical companies to allow them to bring on extra scientists and extra researchers and begin the development process. And instead of waiting until the end of the phase 3 trial, they wanted to start the manufacturing process right away, early on in the phases, so that when they found winning candidates, the manufacturing process had already begun. So there's a risk in all of that, that some of these vaccines may not pass the muster, and so there will have been money invested that ends up being, I guess, wasted in a sense, but really it's helped us to have a very fast process. So normally vaccines take years to be approved. In this situation, we've approved the COVID vaccine in 12 to 18 months. And I want to assure people that the Moderna vaccine included 30,000 people in its study. The Pfizer vaccine included 43,000 people in its study. So lots and lots of people were participating in these trials. And the FDA made it very clear from the start that they were not going to waver on the requirements that they have to approve vaccines. So they made it clear to these pharmaceutical companies that they were going to have to go through the rigorous process that they have to go through with other vaccines, but it was going to happen at a quicker pace because more people were involved due to this funding. So the other important thing for the FDA, because they knew there would be questions about the speed at which this vaccine was developed, they wanted the process to be transparent. So they made it a point from the beginning to have open forums where they brought in independent scientists and reviewers to participate in discussions that were open to the public, so that it didn't appear that anything was done, behind the scenes. And I think that's helped all of us in the medical community feel very comfortable with these vaccines. Operation Warp Speed was perhaps one of the greatest examples of collaboration between our federal government, pharmaceuticals, scientists, even military strategists were brought in to help determine how to coordinate things. So lots and lots of funding, but now we have vaccines that are very promising. And so then Moderna and Pfizer vaccines were both given emergency use authorization. Well, what does that mean exactly? The FDA in times of crisis has a process where after a vaccine or a medication, for example, goes through the validation process and the scrutiny, and it appears to be promising, even though there may still be some questions about, not about safety, but about, do we need booster doses? Is it going to work in kids? Other questions that we can learn about along the way here. The FDA will allow a pharmaceutical to release its product under this emergency use authorization because in the case of COVID, we have thousands of people dying every day. And so we needed to have something to save us, basically. So even though we are now using these two vaccines, they are still in parts of their phase 3 trials because we still need to know, will we have lifelong protection after dose number 2? Are we going to need a booster in 10 years? Is this vaccine going to prevent asymptomatic infection? For instance, if I get vaccinated and I'm exposed to someone, could I still be carrying that virus in my nasal passageway, for example, not making me sick, but passing it on to someone else? Those are questions we don't know yet, but lots to learn, and we will know those things as these phase 3 trials are ongoing. And the other thing is, in both of these vaccines, the Pfizer one especially requires intensely cold storage conditions. So can we come up with a more stable vaccine that doesn't require these difficult storage criteria? So we've now administered over 12 million vaccines in the United States. The safety profile appears to be good. And of course, when bad things happen, they are publicized. So it seems like they are much bigger than they are, but honestly, there isn't any medication I can prescribe. There's no vaccine I can give that doesn't have some risk associated with it. So in the grand scheme of things, this vaccine, it looks like, is shaping up to be as safe as the majority of other vaccines that we have available to us today. So we're looking ahead, and estimates show that we may lose 100,000 more people over the next 4 weeks to COVID. And it's really startling to think that 1 out of every 860 Americans has died of COVID. And JAMA just released that COVID is now the leading cause of death in the United States. So more than cancer, more than heart disease, COVID is killing more people. So I think about this, and if I were to offer my patient a vaccine and tell them to wear a mask and they could prevent cancer or they could prevent a heart attack, I bet there would be a lot of takers. And now you're in a situation where we have a disease process that is causing even greater death than those things. And we have these two avenues that we can use to help turn the tide. So I'm really, really hopeful that after tonight, people will have a better comfort level with our vaccines.
Thank you, Dr. Really appreciate that science behind your answer there. So now we're at the part of the press conference where I think a lot of people have questions. Just glancing through the chat, everybody wants to know, when can I get vaccinated? So Jesse Phelan, that is your question tonight. Let's talk about the local COVID vaccination process. What can you tell us today?
Yeah, I wish it was an easy, straightforward answer. Unfortunately, it's not, but I want to let you all know what we know at this time. And of course, we'll continue to keep you updated. So just to be aware, to lay the groundwork for this to begin with, it will take several months before we have widespread vaccination available for everybody in Sauk County. And once that does happen and it's available to the general public, there will be many avenues to potentially get that vaccine, be it your doctor's office, a pharmacy, a mobile vaccination clinic, or potentially here at the health department. We want everybody to know that we're committed to ensuring that COVID vaccines are available and accessible to everybody, all Sauk County residents. So at this time, as many of you know, we are in what's called phase 1A, which is the vaccine prioritization for healthcare workers, skilled nursing staff, and residents, along with law enforcement and firefighters. Starting on Monday, added to that eligibility list is folks who are age 65 and older. So this is a large group of people. I do want to put this into some perspective. There are about 12,000 folks in Sauk County who are age 65 and older. So if you think about, let's talk about supply and demand. Right now, each of our 3 healthcare systems and Sauk County Public Health get right around 200 or so vaccines per week. So we can vaccinate approximately 800 people per week. Now that can change. We don't know going forward what that would look like. But soon also our pharmacy partners will be vaccinating people, and we hope that that number will increase as more providers are approved through the process that they need to go through. But given our current supply situation, it will take several months to get through the 65 and older group. So what we're asking for is right now, please have patience. These changes come rapidly from the state, and we are trying to adjust and adapt and make things, the knowledge available to you, and make vaccine as available as we possibly can. So if you fall into that 65 and older category, we encourage you to try to go to your medical provider for that vaccination. Now, each of our 3 health systems has a little bit of a different process. So we encourage you to try to visit their website and see what the process is for your particular location. And they are all doing their best to get things updated as well and make changes as changes occur. But try to get the information there first, because we want to keep the phone lines open for people calling for much needed appointments or concerns or questions they want to ask their doctor. We want to keep those phone lines open. So please, before you ring them about those questions, look at the website first and see what you can learn there. So, all right. And then another thing we wanted to touch on was, If you do get scheduled for vaccination, please make sure that if you have to cancel for some reason, that you let somebody know. Don't just no-show, because the way the vaccine is designed, once a vial is open, it's only good for a short amount of time. So we want to make sure every single dose is being utilized and that nothing would have to be thrown away. So we do ask that you make sure you cancel an appointment if you're not able to attend. So kind of circling back a little bit to the rollout, again, just a reminder, we're in phase 1A. There will be phase 1B and C and so on. And phase 1B is looking to be finalized next week. And that will be going through this Department of Health Services at the state of Wisconsin. And again, because the eligibility is there, it doesn't mean that immediately everybody will be able to be vaccinated. Again, going back to the supply and demand, just know that soon we should have more information about who is falling into the next category. And we will certainly all be sharing that out with you. So just making sure I'm not missing anything here. And just be aware that we are doing our best to, again, get these vaccines out. Just remember that we do have guidelines we have to follow that come from the federal government through the state government and are passed on to us. And as registered vaccinators, there are some rules we have to adhere to. So just know that we are doing our very best within the limits we're given. So.
Excellent. Thanks, Jessie. And it's helpful, I think, to remember as we're all impatient to get the vaccine that we are months ahead of where we thought we'd be. If you look back, I have some magazines at home. I'll do too from, October, and people were saying that there wouldn't even be a vaccine available until April, so we're doing well. We're ahead of where we had projected, but I know you hear the news, it's eligible for you, and it's frustrating to not be able to get that information immediately on how exactly you can get it and when and where. So thank you all for being patient with that. We're going to turn next to Dr. Murphy to hear about vaccine side effects that people are curious about. So Dr. Murphy, tell us, what will people feel like after they receive the vaccine? What are the side effects, and what does it mean if I don't feel good after I get the shot?
So the most common side effects that we are hearing about, and that actually I was lucky enough to experience, is I feel very blessed to have been able to already gotten my vaccine. This is a sore arm. That's almost kind of universal, but not so sore that you can't use it. Just, headache, most often after the second vaccine, is very common. Some muscle aches, like a flu-like feeling. There's a few people who have called to say they got a little bit itchy, for which Benadryl was totally covering their symptoms. There was some question about, if I'm allergic to thimerosal, or I can't be around this or that. There's no thimerosal, no aluminum, no mercury in these vaccines, Moderna or Pfizer, and I checked Johnson & Johnson, and not in that either. There is a statement that is put out that if you have ever had an anaphylaxis reaction to a vaccine, anaphylaxis is a very severe allergic reaction where your throat starts to shut down, you have trouble breathing, your blood pressure will drop. It's a very serious condition. If you have had anaphylaxis to a vaccine or any of the ingredients in it, you probably are not able to get that. But that's really, really a small group of people. So if you do get your vaccine and you get the sore arm, you get a little headachy, be glad, because that is actually a good thing. Your immune system, as Dr. Baker talked about so eloquently, is making the antibodies which will be there to protect you in the future. So usually acetaminophen, some Benadryl if you get itchy, day off of work if it's really that bad, but most of us have all gone to work the day after we've gotten even our first and second vaccines, and we've all done pretty well. So I'm very, very encouraged. Thank you.
Thank you, Dr. Murphy. We're going to turn next to Dr. Todd Shad with Sauk Prairie Healthcare and the Reedsburg Area Medical Center. What else do people need to know about the vaccine, Dr. Shad?
Well, boy, is that a broad question.
I really gave it to you, didn't I?
Yeah, there's so much to know about the vaccine and so much that we still have yet to learn. Probably one of the most important things that people need to know is that we really need to make sure that people get both doses of the vaccine in order to receive full protection. There was some data published in December from the Pfizer trial, which showed that there was a 52% effectiveness after the first dose of the vaccine. So really, 50% protection after one dose. And the vaccine did not start working for at least 12 days after that initial vaccination. So that's important because some people think, well, I'm vaccinated, now I can go see my grandkids, or I can go see friends that I haven't had a chance to see. So that is not the case. You need both doses. When you receive that second dose of vaccine, that will increase the effectiveness of the vaccine close to or possibly above 95%. So it's important to get both doses of the vaccine. Dr. Hupp had alluded to it in her discussion. Some people ask, well, why do I need 2 doses? And it's worth reminding people that there's a lot of the vaccines that we give that require more than 1 dose. For instance, hepatitis B vaccine. For some of you, so currently it's given to babies, but for some of you, you may not have received it as an infant and you may have received it later on in life, and you have to get 1 dose, and then a month later you get a second dose, and then approximately 4 months after that, you get a 3rd dose. So think of that booster dose, because this is what's actually happening. The booster vaccine allows the body to fine-tune its response to the virus. That's why you see that increased protection from 52% to 95%. Another way to look at it is when you jump rope the first time, you're probably not so good at it, right? But when you do it the second time, you're gonna get better at it. So it's just a natural process, and our bodies just follow that natural process. So that second booster dose is very important. Yes, there are some potential side effects like Dr. Murphy had referred to, but they're still fairly mild. There's been over 1 million doses of the vaccine given, and the number of severe side effects, such as the anaphylaxis, are extremely, extremely small. So really, you want to make sure you get both doses. The only people that we would not recommend that second dose to would be if they had one of those really bad reactions like the anaphylaxis to the first dose. But again, that's very rare to get. Now, this current situation that we're in is rather unique. Because this has all played out in front of us over the past several months to a year, almost a year now, people have been very keyed in to the fact that there's different vaccines. Prior to this, nobody cared what hepatitis B vaccine they received. It was just the hepatitis B vaccine. This time it matters. So it's really important that you receive both vaccinations from the same manufacturer. Let me say that again. Both vaccinations from the same manufacturer. So when you leave your vaccination clinic, you'll receive a card that lists which vaccine you received. In addition, the vaccinator is going to put that information in the Wisconsin Immunization Registry. So there's going to be 2 different places that it's located. But they will also help you schedule your follow-up appointment for receiving the second dose of the, you got it, same vaccine. So that's why it's important that you go to the same vaccinator that you received your first vaccine from. So if you received your first vaccine at SSM in Baraboo, you want to schedule that follow-up with SSM in Baraboo. You don't want to skip around to different providers because SSM might have a different vaccine than Reedsburg or Sauk Prairie has. So make sure that you go to the same vaccinator as you received the second dose. And also remember, because these dosages are so limited, we are getting our second doses based on the number of first doses. So if people start skipping around, we're going to run out of doses, and we don't want to run into that problem. So please follow up with the same person that you scheduled the first dose with. One piece of good news, the vaccine is free to everyone. One of those very rare things. It's completely free to everybody. Now, the different healthcare providers may charge an administration fee for the vaccine, but insurance companies are covering that administration fee. So that's really good news. I'm going to, I think, leave it there for right now, Jesse. I have some more questions to talk about related to pregnancy, et cetera, but we'll come back to that a little bit later, I think.
Okay, sounds good. Thank you so much. And to clarify as well, if you don't have insurance, that's okay. The vaccine is still free. So I wanted to make sure that that addressed one of the questions in the chat here. Excellent. Let's go on then to Barb in public health. Do we still need to wear masks and keep social distancing while we roll out the vaccination process?
Thanks, Sarah. Yes, that is still currently the recommendation to continue with our pandemic behavior of social distancing and wearing masks and hand washing and isolating and quarantining if you have symptoms of illness. In doing this, it's making it easier for those that are vaccinated and receiving the vaccine for it to do its job for in the future. We're still not quite sure as to the level of protection or immunity that the vaccine is providing. Research has shown that it is reducing severe illness if you are exposed to the COVID-19. But as a couple of the other panelists had discussed, we're not quite sure if you're exposed after vaccine, if you're exposed to COVID-19, if you are able to become a carrier and then transmit it to someone else. And so we are still recommending that you take all that protection and guidance that the Centers for Disease Control and everyone has been talking about to limit your risk of exposure or in transmitting the virus. This will take a while. It'll take months for us to reach this community immunity. And so we need to keep on using these protective behaviors until we can give a chance for everyone, or at least 75%, to get our community immunity level up for people to be protected and for the disease to start decreasing in our communities.
Thank you, Barb. Let's go back to Dr. Shad if we can here. And if you could talk a little bit about people who have recovered from COVID-19, had the disease, recovered, should they get vaccinated? I know there have been a question or two about that in the chat.
Yeah, thanks. So if you've had, so this is somewhat complicated, but if you have had COVID-19 and have recovered from it, we are still recommending that you get vaccinated to the COVID again. Currently, the estimates are that after an infection, an acute infection, you are possibly protected for somewhere between 5 and 8 months. Again, there's lots of studies going on, and there's a little bit of a range. Initially, we were thinking it was 3 months, but some newer information came out suggesting maybe it's 8 months. But somewheres around that 5 to 8 months, it seems to be kind of the sweet spot where you're protected. We do know, however, that there has been a small number of reinfections that have been recorded around the world. Now, those are recorded infections. Certainly, we've all heard of stories of people getting it, but whether or not it's been confirmed or not is different. So we're watching those very closely. And the length of immunity appears to be tied to the severity of illness. So if you are somebody who was lucky enough to be asymptomatic from the virus, your level of immunity or length of immunity is likely going to be shorter, maybe closer to that 3-month mark, than somebody who was in the intensive care unit or was really sick from it. They're probably going to have a larger immune response because their body had to work harder to get rid of that virus. So they had to build a bigger army of antibodies to kick that virus out. So the severity of illness seems to matter. Let's see. So as a result of that, ultimately what we're suggesting or recommending is that if it's your turn in line to get the vaccine, do it. Now, if you just recently had the illness, so let's say you're in that 2 to 3 month window and you're not in a high risk group. So let's say you're 30 something, overall healthy, no real other risk factors, you're not a healthcare worker, you might choose to not get your vaccine so that somebody else who is higher risk may be able to get the vaccine. So that would be a reasonable thing to do. But in general, if you're given the option, we're encouraging you to still get vaccinated. And ultimately, it goes back to what I was talking about before. The more times you're exposed to the jump rope, the better you're going to be able to jump rope. And so in this case, the more times you're exposed to the virus, not the true virus in this case, because it's the vaccine, you're going to have a better response and going to be safer in the long run. One of the other questions that's been asked is, what about age restrictions? So for the Pfizer vaccine, that one is authorized to anybody that's 16 years of age and up. And for the Moderna vaccine, it's authorized for anybody 18 years of age and older. And those age limits were purely based on the studies that were done and how they set up their initial studies. It doesn't mean it's unsafe for somebody less than age 16 or 18 to get the vaccine. It's just that it hasn't been studied. So those are the age restrictions. And then another, I think, helpful or important point is you should also wait 14 days from any other vaccine that you may receive. Now, this year, we're already through most of the flu season, so hopefully most of you on this call have already received your flu shot. But if you were to get your flu shot today, you would want to wait 2 weeks before getting your vaccine for COVID. Or, for instance, if you got the tetanus diphtheria vaccination, again, you'd want to wait 14 days. Or if you got the COVID vaccine today, you'd want to wait 14 days before you get a flu vaccine or pneumovax or any of those other vaccinations. So you want about 14 days in between vaccinations. And that's just to allow your immune system a chance to deal with one thing before it goes on and tries to multitask on a different vaccine.
Excellent, thank you. And now we'll turn to Jeff Jelnick and ask where people can turn to for more information. I know people have so many questions. I'm seeing the chat box just alive with awesome questions, and we'll try to get to at least a few of them with our remaining time. But before we do that, Jeff, would you like to tell us about where people can go for more information?
Yeah, thank you, Sarah. Thank you to the panelists. It's great information. So as we continue on here, as you can imagine, this is changing hourly, daily. So we will try to keep everybody informed as much as we possibly can. And there's a couple different places you can go on our Nixle. You can sign up for Nixle, which is a secure system, and only individuals from first response and emergency management agencies send out information. And that's very simple by texting your zip code to 888-777. So just texting your zip code to 888-777. You can also sign up for the Facebook, Public Health's Facebook page, and they are going to put the links in the chat for you so that you can get onto those, or our Sauk County webpage. Very, very important. We can get a lot of information there. And that, as I said, it continues to change. And as it changes, we try to keep that up to date as much as possible. With that, a lot of us, and all of us have sacrificed somehow through this whole process with our loved ones, not being able to do the things that we do on a day-to-day basis. And we understand that, it's been a long 10 months. It's been a long 10 months for everybody. And we are seeing a light at the end of the tunnel. So as we work through this vaccination process, we ask everybody for patience, just to wait your turn. And I know it's hard. And I know when your turn comes, you might not be the first one in line. But I can guarantee you, we have a lot of partners that we work with on a day-to-day basis, folks that are doing vaccinations that want to get vaccine into people's arms. And when we talk about vaccine, you've heard doctors talk about it, the importance of getting vaccinated, not just for COVID, and that's when it becomes available, the COVID-19 vaccine, to get that, but also our seasonal flu and other vaccinations, just being such an important part of life and maintaining a safe public health life as we move through this journey here. So I want to just thank everybody, and the key thing here is patience, please.
Thank you, Jeff. And now we'll turn to Siobhan, for any questions in the chat. And I can tell there are dozens of questions, Siobhan, so I know it will be hard for you to choose the first one, but go for it.
All right, thank you very much, Sarah. Give me just a minute because I was pasting in a bunch of links into the chat, and when we have the replay for this, I will post it as well. And then so that our Facebook viewers aren't left out of the loop, I will also be putting these links into the comments of the Facebook feed after the live video is done. So one of the questions that we have, and maybe this would be best suited for Dr. Shad, is asking how long after the second vaccination do you have to wait for immunity? So the specific question was for 95% immunity.
Yeah, so again, based on the research through Pfizer, it's approximately 12 days after that second dose. So figure 2 weeks just to give yourself a little wiggle room there. And I also saw in the chat, and this is just an easy question to answer, the egg question. If you have an allergy to eggs, there's no eggs involved with this vaccination. So it is completely safe to receive the vaccine if you have an egg allergy.
Dr. Shad, would you also like to talk about pregnancy or expectant mothers, what they should do in terms of vaccination?
Yeah, so I realize we're running low on time, so I'm going to try and do this a little bit quick. So I apologize if I don't go into things in too much depth, but I want to just kind of go through a couple of things. So first off, I think this highlights a really important concept in medicine called shared decision making. What that means is the decision to vaccinate should be a discussion with you and your healthcare provider to help you make the best decision for your own personal situation. So very important to have that discussion with your healthcare provider because everybody is a little bit different, but it's ultimately your decision. So first question is, what if I am planning on getting pregnant? Should I get the vaccine? And so right now, the CDC and the American College of OB-GYN is currently recommending that all women that are able to receive the vaccine should receive the vaccine. There is no waiting period after you receive the vaccine before you can try to attempt pregnancy. In the Pfizer trial, there was 23 women that did become pregnant after they received the vaccine. Of those 23 women, there was one patient who had a bad outcome. However, that patient received the placebo. So she did not actually receive the vaccine. So from a general safety, just from that limited number of pregnant patients, it has been shown to be safe, as are most vaccines in pregnancy. Again, during pregnancy, we do vaccinate against the flu, and we also vaccinate against pertussis during the pregnancy. So people that are considering pregnancy should get it. There was a concern or a question raised on Facebook about whether or not it causes fertility issues, and that was related to a few amino acids that were the same between the spike protein, which is what the vaccine helps us attack, and a protein in the placenta, but it was only 5 to 6 amino acids out of 1,300 amino acids that they shared. So that's 0.4% similarity, and our bodies are much smarter than that, and our bodies are not going to attack that based on all the data that we have to date. How about if you are pregnant, should you receive the vaccine? So we know a couple of important things about COVID in pregnancy. First off, pregnancy does not increase your risk of getting COVID. So that part is good. However, if you are unfortunate enough to get COVID while pregnant, your severity of illness is much higher. In fact, if you're pregnant and or have diabetes, or if your body mass index is over 35, you're at a significantly increased risk of being hospitalized for COVID. Of those women that are hospitalized with COVID, they have 3 times the risk of being admitted into the intensive care unit. They have 2.5 times the risk of having to be placed on a heart-lung machine. I have one known patient that has had to deal with that. And they have technically a 1.7 increased risk of death from COVID compared to somebody who's not pregnant. So again, we know that if you're pregnant and you get COVID, you can get very ill. So ultimately, the Centers for Disease Control and the American College of OB/GYN both recommend that women discuss the vaccine with their providers and try and get the vaccine as soon as it's available, particularly if they have diabetes or a body mass index greater than 35. And there's some studies that suggest hypertension should also be included in that group. Or if they have multiple exposures due to work or family that would put them at a higher risk, they should really consider getting the vaccine. The second option would be waiting until you give birth to get the vaccine, which would be a reasonable option, particularly if your only risk factor is the fact that you're pregnant and you're able to control your exposures by limiting your interactions to other people outside your household, and of course, using protective methods, masking, safe distances, etc. Or you can consider just trying to modify your exposures to the vaccine, or excuse me, to the virus. Most of us have ways that we could be a little bit stricter with our limitation of socialization, etc. So that would be a third option. But overall, particularly women who have diabetes, high blood pressure, or have a body mass index over 35 and are pregnant, we would encourage them to receive the vaccination. And then finally, those women that are breastfeeding, many know that breastfeeding is very positive for the baby and it helps to protect them because of the immune system of mom. And from what we know so far, the vaccine seems to also help that immune system and then would pass that along to the baby through the breast milk to give the baby some protection. However, that being said, there really has been not a lot of research to date on breastfeeding moms because they weren't included in the trials. But based on best evidence we know so far, we would recommend that they do consider taking it. So I wanted to make sure I covered those 3 questions. So I hope that was helpful.
It was. Thank you so much, Dr. Shedd. And thank you to all the panelists. I think since we only have mere seconds remaining, we're going to wrap up. I know all of you really were active in our chat and have questions. A number of you still have questions. Siobhan has put on the chat how you can follow up with us on our website and hear answers to those questions. We'll also include them. We do weekly calls every Thursday that are recorded. They're more of like a video vlog, you would call it. And those are put on our website for you to watch as well. And we will answer your questions that way. I know a lot of the questions were about distribution of the vaccine here locally, and Sauk County really is doing the very best we can with all of the vaccine that we can possibly get. We're one of, I believe we were the first county to employ the National Guard to help us vaccinate people. Is that true, Jeff? Yeah, so we're really doing everything possible. We know how much you want this vaccine, and we're trying to get it to you just as soon as we can. So thank you all so much for your attention tonight, for your patience with us as we roll out this vaccine process, and for your hope. We can feel it in this room on Zoom, how hopeful we are that we can conquer this virus and move on with our lives. So thank you all again. Have a wonderful evening, and we hope to see you again soon.